Hi, my name is Eliano Ekabaretu from Timor-Leste. In this presentation, I will talk about how I work with Reinforced Basic Health Services project funded by USAID and implemented by JSI Research and Training Institute to provide community prevention and education on COVID-19 for young people in Timor-Leste. I'm a trained nutrition educator and adolescent reproductive health facilitator with JDN, a national youth-led organization providing community-based peer education in Timor-Leste. JSI had partnered with JDN to provide adolescent reproductive health education, and we were very excited when JSI invited us to work together in preventing the spread of COVID-19. A team of JDN Youth Educators, we work with our advisors on all aspects of planning, designing, developing, and implementing COVID-19 preventative education. We were trained as COVID-19 educators. Then we each recruited a small team of 4 other young people who we trained using WhatsApp groups, Facebook, Zoom, phone calls, and sometimes we met in small groups. A total of 21 peer educators began adopting COVID-19 preventative practices like hand washing, social distancing, and not touching our faces. We demonstrated our changed behaviors, and other young people began to do the same and influenced our families. That's how we educated 166 young people directly and reached over 13,000 young people with COVID-19 education messages that were posted on Facebook. JSI used a youth-led peer approach adapted to a state of emergency restriction in Timor-Leste to train 21 COVID-19 youth educators. As peer educators, we designed a pre-test and conducted a rapid assessment of young people's knowledge of COVID-19. After analyzing the pre-test results, we used them to design educational materials and tools to address knowledge gaps and misconceptions about COVID-19. We used face-to-face and online programs to educate other young people, family members, and neighbors in order to reduce discrimination and stigma, model preventative behaviors, and promote health protective behaviors with young people, families, and neighbors. Quantitative and qualitative data was collected to show the results of this 2-month project, particularly through the education of 166 young people by trained peer educators. Quantitative results demonstrated that the methods and materials we used were very effective in correcting misconceptions identified in the pre-test. For example, knowledge of 3 main symptoms increased from 71% to 94%. Stating wrong symptoms decreased by 30% to 0%. Fear of quarantine areas decreased from 63% to 3%. Qualitative results showed that 75% of beneficiaries began washing their hands regularly and influenced behavior change in their families. As one 22 years old female said, "I put the poster receipt from JDN on how to properly wash hands on the wall so that my family also can follow. And I also set up a hand washing station so that everyone coming into the house washes hands." Investment in the training of youth educators to engage educate, and motivate our peers to adopt health protective behaviors, provided a skilled resource base that could readily be equipped to work in epidemic mitigation. Best practice interventions ensure that behavior change is not just among target beneficiaries, but also among friendship networks and family members as a contribution toward the adoption of healthcare protective practices in the broader community. Thanks for your interest in this work with youth in Timor-Leste. Please contact me or any of our team if you would like more information or to work with JDN or JSI. Obrigado, Barak.